All right. Okay. Well, good morning, good afternoon. Thank you very much for joining us. So I'm really excited about today. We will talk about a few things today. We will talk about the innovation in healthcare specifically. We will talk about the challenges that are specific to healthcare innovation. We will also talk about the emerging technology and the methodologies that exist and that can be strengthened by this technology that can help speed up, improve, and de-risk innovation, specifically in healthcare. And we will share a lot of resources with you that will help you on your innovation journey. Um, there is a lot of resources available at no cost. Bryan alluded to them. So healthcare medicine started with the premise of first doing no harm, right? First doing no harm was the first was the fundamental premise of medicine. Yet, because of the complexity of the system, because of the risk aversion, financial constraints, uh, we often see innovations that could save lives, could help people, could alleviate suffering, not move forward. Let me give you an example. In 1922, the first insulin injection was administered to a young patient. And at the time, that was a major breakthrough. That was the first ever way of managing diabetes. But then for many decades, nothing essentially changed. So for many decades, it looked exactly like this. But then something incredible happened. Eli Lilly partnered with IDEO, a world-class innovation company, to reimagine insulin delivery. And the result was the QuickPen. It revolutionized insulin delivery. It changed how people manage their diabetes. Uh, Adherence improved, outcomes improved. It was a true breakthrough. Here's the kicker. It took 15 years and millions of dollars to get to this device. Now, what if I told you that today we're on the verge of accelerating those timelines dramatically? We're on the verge of being able to shorten innovation cycles from years to months or even weeks in some cases. You see, about once in a generation, technology makes a giant leap forward. In the 1990s, it was the internet. In 2007, iPhone came out and put the power of computing in our pocket. And I believe that we're living through another one of those leaps right now. In 2022, OpenAI released GPT 3.5, and all of a sudden, AI went from technology that was 20 years away and always would be, as the joke went, to something that was immediately available, something that we could have at our fingertips, that we could use to cross-reference, comb through, and correlate massive amounts of real-world data in seconds rather than hours and days. Um, we're living through the fourth industrial revolution right now. We're living through the Cambrian explosion enabled by this amazing technology. And admittedly, there is a lot of hype, a lot of things that will probably not go anywhere, just as it was with the internet, just it was with the first wave of smartphone apps when first smartphones came out. But there are lots and lots of very smart people spending inordinate amounts of time, money, and energy uh, trying what we have today, applying it to real world problems, learning from that, and iterating. And whoever iterates and learns fastest will, in the long run, win. So the important thing to remember is that this is not just about the technology. This is not about technology replacing human intelligence and human ingenuity. It is about technology augmenting and supporting it. It's about smart humans equipped with incredibly powerful technology. And in a few minutes, in a couple of minutes, we'll show you exactly how this works. But first, let us introduce ourselves. Who are we? My name is Andrew Perry. I've been in technology for 20 years, bringing innovation into some of the most change-resistant environments on the planet. I ran the team that rebuilt the rural healthcare program for tens of thousands of rural healthcare providers across the United States, allowing the program to grow 5x in 2.5 years. Medicine is personal for me. So when my son was born, it was a difficult delivery. And when I picked him up for the first time, two things became extremely clear to me. First was that I loved that child more than I ever loved anything in my life or anyone. And the second was that I would spend the rest of my career helping amazing doctors who saved his life and the life of my wife. So that's why I'm doing this. Bryan, over to you.
So I know a lot of people here. That's kind of cool. My name is Bryan Cassady. I'm a serial entrepreneur and actually really a serial entrepreneur. I've done 11 companies in 6 different countries. I have 8 exits along the way. In the healthcare business, I was the CEO, interim CEO of a diabetes treatment company called Sweet Bee. It failed. I was the global marketing director of IBA, which is the world leader in protein therapy. It succeeded massively. I've also worked with Novartis, AstraZeneca, Bayer, hospitals, HMOs, insurance. And currently, I'm doing a lot of work with accelerators and leading universities, training the innovators of tomorrow. My personal mission is to coach, train 1 million innovators by 2027. A secret here is I've only done 5,000 this year, which means I have 199 years to go. A big part of my plan to reach that total is AI based. I teach with AI. I work with AI. I work with companies with AI because it allows me to scale the teaching process and the consulting process. And I'm here talking about healthcare because I just think it's one of the most amazing sectors and one of the sectors that needs the most in terms of innovation.
Yeah, good morning, good afternoon to all of you. Also a pleasure to see quite a lot of colleagues and friends here in this webinar. Myself, Oliver Schreck, I've been in the medtech industry for 25 years, executive, leading a variety of different teams in a variety of different companies, bigger and smaller startups around the world. On the other side, I've been always involved with innovation and ideas. I have myself over 25 granted patents around the world, most of them in medtech. And now I'm using also my experience there in advising startup companies in the medtech arena, helping them to get their feet on the ground, finding the path moving forward. And if I look at AI, for me, it's kind of evolution there. I've started working at AI kind of 24 years ago when it was still called neural networks within Siemens, where we're doing a nice program for improvement of the image quality there on MRI systems. At that time, it failed. It was just too computing intensive to do and calculate all those models. Nowadays, that is implemented and it's working. So thankfully, to the increasing of the computing power there, we have it at our hands right now. The picture there on the right, it's not my boat. I wish it would be. That is America's Cup race in 2013 in San Francisco. And the interesting part of that, these amazing boats are all the same. And so the interesting part here is the winning is how you assemble your team, which team you have to compete against each other. And I think that with us here, 3 having the experience in healthcare and innovation, we definitely can bring a lot to the table in order to make this a winning thing moving forward. So the question is now how we came together. Okay, so some months ago we met and discussed about, okay, what are the typical challenges that we have faced in the past driving innovation in healthcare, and what are the issues that we face there? This kinds range from compliance, complex products, regulatory challenges, long development times, difficulty to bring always the right stakeholders in the room, have bias discussions. So it's really a lot of different challenges in healthcare that we see there in order to really drive innovation forward. So it's kind of very slow. Whoops. It's okay. Stay here. It's very slow, hard to drive forward. It has a long development cycle. Healthcare products stay in the market for a long time, take whatever, 3 to 7 years to come up with a new product and roll it out. The ideas are often mediocre, as it's driven often by engineering. And there's definitely a lack of testing, in the sense it's a difficulty of testing more than a lack, or the lack results out of the difficulty of testing there. So what are the main healthcare challenges that we have identified here? The first one is the time to market. So as I said, we have highly complex products for specifically in the medtech arena. So an MRI, a CT, a PET, or then the combination of those, like a PET CT or an MRI Linac, that are really high complex products there. With that come really long development cycles, 10 plus years, a need for clinical trials and validation, and then of course the regulatory burdens there, making sure that we are able to bring the products into the US or the Europe or China and the corresponding regulatory parts. Related to that are then, of course, the financial constraints that come on top, like the high development cost for such a new product. And then, as I said before, having these long product life cycles with 10 plus years. So it's not only the cost on the side about developing new products, but also kind of maintaining and servicing the existing products that are in the market that you need to maintain as a company. And then comes on, due to that, also the right market fit. Okay, we have a slow innovation rate. Age of new product introduction for medtech is between 3 to 7 years. For pharma, even longer. For digital, it's a little bit shorter. And then my experience has been that very often innovation is really engineering driven. Engineers come up with a great idea. They think that is what it is going to be, but they don't have the access to customers. They miss the customer focus, and then come up with ideas that they think is the best, but at the end it's not worthwhile, or there's no real business case behind there. The other thing that I've seen over the last years is that the digital revolution is really overpassing hardware only products. The value that is brought to the customer, meanwhile, is less so much on the hardware side than more and more on the software side, which makes it, again, a question of speed coming to the market. And then the amount of multiple stakeholders. So not only in a company, but also outside, like the patient, healthcare provider, insurer, different countries, different regions, and so on, which make it really difficult as a healthcare to provide the right market fit.
So the content of our discussion was saying, well, look, either we can give up or we can try to do things better. And the thought that came up in our discussions is maybe by using two tools. One is a sprint framework and AI, we could do things more effectively. When we started these talks, I talked a lot about the need to focus your energies. For a product that takes 7 years, you're not working full time over 7 years, but you're actually having certain activities that you're doing over those 7 years. And say, look, the right thing to do is to focus on the areas which generate the most potential. And that's well defined in the Pareto principle. So you all know the 80-20 rule. So 20% of your effort delivers 80% of your result. What you might not know is that's also the 4-64 rule. So 20% of 20 is 4%, 80% of 80 is 64%. So 4% of the efforts deliver 64%. And you can keep on going down until we could actually get to a really short sprint and see how much you might be able to do in that period of time. The challenge is usually not to go faster, but to carefully choose what you do and what you don't do. My question back to Oliver and to Andrew is that what are the biggest activities here? What is really most important in that 7-year time plan you might be able to do quick and now?
Yeah, so my experience has been that very often one of the biggest challenges really is to align the people around what is the real objective, what is a problem that we really want to solve, and not to go off on tangents. I mean, if you think about the really complicated products there, they have so many decisions, so many innovation elements, so many kind of ideas that come up during 7 years of cycle that you need to kind of bring people back and back together again and again. So bringing and aligning people is really one of the biggest challenges there. And then, of course,
I agree. I'm sorry. I agree completely. Just maintaining focus and keeping coming back to what's important and not getting distracted by anything else. I agree.
yeah. And at that then comes what I mentioned before already, is kind of making sure that the innovation that you come up with really resonates with the customer that is going to buy the product. So what it would be if you could just do this in some few days instead of bringing everyone that you need as a stakeholder in the room, have the expert on your side that helps you to define, to bring in all these different perspectives that you need in order to drive innovation and to come up with the really great and big ideas that will disrupt the market.
Mm.
So I think, when I look at your picture here, I picture a big beach party with everybody trying to push forward innovation, lots and lots of work, lots of people involved. But there is a tool out there which actually works really well to get people together for a short period of time. And it's also a really good tool to focus people's efforts. That tool, which I use a lot, is an innovation sprint. The innovation sprint was originally popularized by a guy named Jake Knapp at Google Ventures. And he talks about a structured format where you're doing work day by day. Now, there's probably as many shapes and flavors of innovation sprints as there are flavors of ice cream at Baskin Robbins, but the basics are essentially the same. He's looking at the original sprint at a 5-day process. Day number 1 is actually trying to figure out where you're going, defining the problems and the challenges you want to work on. Day number 2 is about building ideas. Here it's called sketching ideas. Nobody uses sketching anymore, but the idea to try to build a lot of creative ideas in a short period of time. Day 3 is about deciding on the best option, making a commitment. Day 4 is prototyping it, and day 5 is to test it. Now, this process works really well for a couple of reasons. The most important is it gets people together, focused on a process where decisions need to be made step by step. There's also forcing moments. The forcing moments is you have to be done with your concept in 2 hours. And lo and behold, you get finished with your concept in 2 hours. You have to test it tomorrow morning by 10 o'clock. That gets you moving forward. That focus reduces the time it takes to do things. It also gets people together, rupturing silos within the organization, bringing the people together that don't normally talk together. Secondly, there's a strong focus here in testing. And the idea is testing and validation, make a hypothesis, validate it. When you test things, you get a better indication of what is going to work and what's not going to work. That allows you to make sure that you get the right market fit and that when you're building business models, they actually work. The second reason to run a sprint is they're easy and they're incredibly well documented. All you really need to run a sprint is you need to decide how long it is, what are you going to do, and you have to have a process to push it forward. The big advantage is it doesn't need to be the CEO. It doesn't need to be an expensive consultant. Almost anyone can lead a sprint because you have a specific process to follow. And even if you do it wrong, you tend to get pretty good results. Equally important is you can find incredible number of resources on how to run a sprint. At the end of this talk, you'll be invited to do a feedback. If you fill out the feedback, you get a link to 12 books, 70 articles, 30 articles on LinkedIn, 33 videos, and 6 templates and tools. Anything you want to know about running a sprint is easily available. Now, it's not all, as they say in England, it's not all jam. Everything is not perfect. There are some issues with running a sprint. The first and probably the biggest issue is you get people together for a week and you work really hard, but you work on the wrong challenge, you won't get decent results. The first issue that comes up is too often people work on the wrong challenge. The second issue is alignment in the teams. How do you get people together? And here in a typical sprint, there isn't a powerful process to clearly define what you're working on. There is a retrospective of looking at from the end backwards, but there needs to be more work on the alignment. There's time constraints in the building of ideas. One day to build ideas might look like a long time, but typically what you end up with is a limited number of ideas because of time constraints. A fact that some of you might not know, if you run a 2-day brainstorming, 80% of the good ideas will come up on the second day, not on the first day. The third thing that you have is about getting the feedback. Getting feedback's hard. People don't like to talk to customers. So you tend to make the decisions internally, even though the process says you should be able to make it externally, which leads to a selection bias. Now, for me, the biggest issue with the sprint, as it's run in 5 days, is there's no time for your brain to take a time off. I don't know about you, but I have always my best ideas in the shower or when I'm going for a walk. Ideas need time to soak. What you need is time off from the process to let the ideas germinate and grow. 6, there's half-baked, low-fidelity ideas. And I don't know what I just did. Hold on. Weak action plans. And lastly, it's a complaint about the amount of time. So when I look at your beach party there, Oliver, they're saying, well, that's a lot of time to get 5 people out of the building. What we've been working on is ways to improve this process. This started as a project in my courses, but has actually become a commercial project, which is the AI for Innovation Toolkit. We follow essentially the same processes of sprint, alignment, figuring out what you want to do, building stuff, communicating, checking, systematically improving, and pitching it back. We added 259 tools and 6 apps that you can use through the whole innovation process. And what this allows us to do is to augment and make each step better and more effective than it was before. The first stage here, we do things in terms of market assessment, persona development, and true north, which we'll get to in a bit. We do things in terms of defining problems. And actually, one of the things that AI is really, really good at is defining the right problem. Stimulus mining, we'll come to this. We do a lot in terms of mechanical creativity, idea review, idea merging. We do work with AI on trying to make sure the ideas are clear. One of the challenges, they have a bunch of engineers and trying to communicate in innovation, it's not always obvious. The AI will help them make their ideas more clear. We also do synthetic user testing. We use AI to create high fidelity MVPs. And we use AI at the end of the process to validate the business model design, to build a pitch, and to do a pitch review. So what we have is each stage, we've added something which makes something better. But equally important, what we do is we change around the process. What we do is we compress those 5 days down to 2 days. And instead of it being a 5-day sprint, it becomes a 2-day sprint with a break and an ending point, which is about making it real. What we're seeing in practice right now is approximately twice the results of a 5-day sprint in half the time. I'm still trying to get a client that will let me publish these, but I have done it parallel, 5 days, clients working by themselves. Another one, 2 days working with AI, and the results are amazing. If you want to be the first one to let me publish the results, I'm all in. So
you already asked that question, Bryan, but when we talked some months ago, I mean, I really, my question was, this sounds just too good to be true a little bit, okay? Really, I've done so much innovation, different companies. So what kind of proof points do you have? What can you show us? Where have you used it?
Okay. I've personally been involved in somewhere between 80 and 100 sprints. I've run sprints, which are product development sprints. I've run sprints for startups. And we have a basic sprint project, which there's no change. It's a product design sprint. You want to build a product solution. We don't change things around before or during the sessions. But we also run sprints for branding, for things like, I see Gustavo and Ximena here, which is about market entry to Brazil, innovation expertise. And what we do is we take the basic sprint model and we try to adapt it. And typically the adaptations are before the event and slightly during the event. It's essentially the same recipe each time. Most important part is preparing for success to find out what specific need is needed in that sector or industry or problem. Work with experts, hence my desire to work with Andrew and Oliver, and modify it to fit your needs. You have to have a plan so you can deviate a little bit. Question for you there. Does that give you proof that this might work, Oliver?
I think so. So I think that for healthcare, we probably would need to change some certain things here. I think that specifically we need some more time at the beginning for doing a thoroughly market assessment, okay, to make sure that we know what is going on, what are the competitors doing, and what is really needed. Then, as I mentioned before, we really need to get involvement of experts. We need to make sure that whatever the idea is, there's a clear business model behind that supports the financial aspect of that. At the end, you want to make money, okay? And then healthcare is a highly interconnected system, okay? You need to have all those different interfaces that you need to support exchange of data in a variety of different formats. So there needs to be a clear system, focused system thinking about how you integrate it in what is the kind of the ecosystem in a hospital, for example. As I mentioned before, the user testing is harder. You need to go in hospitals, do clinical trials and so on. Regulatory should be involved from beginning on. I don't know. Just to the audience here, what other changes do you think that are specific to healthcare that we would need to add here?
So I'm just checking in the chat right now, and I see Jason. Jason, you've written me a small book. This is fantastic. Oliver, do you want to read that one and give feedback on it? And I'll read one of the shorter ones.
Sorry, Oliver.
Okay. Thanks for that, Jason.
I can also speak to it if you guys would like, just
explaining
it.
Go ahead, Jason.
Yeah, so I'm working at a small startup, and frankly, it's a company that was failing before joining, and trying to change the entire culture of the company. We had a couple of sales folks who were very used to talking to different clinical collaborators. They didn't have a product yet to market, right? So we started building a culture based on kind of some pillars of excellence: voice of customer, involving as many clinical kind of voices as we could, primary care folks, cardiology, technologists, all these different people, workflow interoperability, of course, excellent in the AI that we're building, the algorithms we're building, partnerships, and the agile process. And a lot of this comes down to a lot we've covered already is the focus. So arranging similar problems, similar personas, kind of into releases or phases, looking at building a release that's really focused around primary care at first, for example, and then moving to cardiology. I guess we've done a lot here, but I think using a lot of AI, when you're talking about kind of the generative AI and everything else, we use it to do all the kind of grunt work or trivial or tedious work. So building out plans, right? As people go on the whiteboard, they sketch out these plans using Post-it notes, having maybe ChatGPT or Gemini read the Post-it notes, build the plans. We're really separating out what's human important and what is maybe not so important, so we can focus on the things that work most. And we're really finding the voice of customer is the most important. I think the challenges that people might say is getting clinical collaborators. I think that's where a lot of people may need help, and I'd love to hear kind of comments about that as we go through this whole session. To us, that became the easiest. It was initially the hardest, but I think there's people in the company that can usually connect you to the right people.
Okay.
Jason, I love this, having people talk. Oliver, you get to react.
Fully agreed. I think what you mentioned about how you used AI there, I think that if you continue to listen for a while to what Bryan has to show here, we take it a step further than that.
That's why I'm interested, guys.
Then let's go for it.
Yeah, let's go for it. I think that is awesome. Getting rid of the tedious work. However, you can get rid of the tedious, so you can focus on the things that
more than that. There's more than
perfect.
That.
Okay. So, but I think what's important is not to oversell this idea of AI. AI is a tool. Anyone that tells you they have an AI strategy, it's like saying you have a hammer strategy. A hammer doesn't build a house. AI doesn't build a business. AI is a tool. But what we can do is look really quickly at how we would change around things for the healthcare sector, adding AI into the mix. So the first thing would be in the preparation stage, and also adding things in terms of research and background information. And this doesn't need to be AI based. In terms of other things we've changed is in the alignment phase of the process. We look at the need to bring in all the stakeholders, get them talking together to break down the silos. At the build stage, one more thing we're looking at, you can build all the ideas you want, but if it's not going to pass your regulatory review, you need to make sure the regulatory review is involved in the process. Before you go further, do not pass go without passing by your regulatory review. In terms of communicating and checking, Jason, you were talking a lot about the need for feedback from different people. One of the things which we're using, which I thought honestly was the stupidest idea when I heard it the first time, is synthetic user testing. Synthetic user testing, you make up users, have AI talk from that perspective and give you feedback. What you'll see is the results are truly amazing. And the last stage is, trying to use AI and other things to do more of a focus on the system analysis and how all the things fit together. Lastly, in terms of the soak time, we bring in more experts, a business case review, regulatory review, and then we make it real. Oliver, what do you think about AI?
Well, I think I've been using AI similar to what Jason just described. Okay, it's kind of an extension of getting rid of tedious tasks. So instead of going through one web page and another, trying to find information, just kind of extending Google and kind of giving me a whole summary about what I'm looking for. Sometimes the content, yeah, it's good, but sometimes it's really, not the best. Let me put it that way. It's time saving sometimes. Sometimes you just get frustrated by what it presents. It has a lot to do with how you prompt it, how you instruct it, how you constrain what you ask Gen AI there to give you as an answer. So there's an interesting finding that just came out, okay, 29th of July. It's kind of that. Meanwhile, some people see that the using AI increases their workload because it seems that it just says to the senior management, well, I have Gen AI, so speed up, go faster, move more, do the same thing in shorter time period. So I'm not sure if that is really true, but it could be.
It's the perceptions of people.
The perception, I think, is a perception.
Three out of four people say, look, AI is not making my work easier, but it's making my work harder.
Yep.
Whether it's true or not, that's another question. I always take out the garbage, but it's probably not true. So there are things that are perception based. What we can start out with is a few facts and myths about AI. And I'm going to go through this rather quickly, and I hope that it be clear as we go through it. The first one is what AI can do. AI can lift all boats. AI can make lots of people more effective. There's a great study out there, and if you take a screenshot and look at the reference on the bottom, where Harvard Business School worked with Boston Consulting Group, having some of the smartest consultants in the world work on creative tasks. They divided those consultants into two groups, the best consultants, top half, the worst consultants in the bottom half. Now, you have to realize the bottom half of BCG probably still has an average IQ of 130, so the bottom is not very bottom. But what they've looked at is the increase of adding generative AI to their effectiveness in terms of doing creative tasks. The top group had a 17% increase. The bottom half had a 43% increase. Those are big numbers. That's a day a week of more effectiveness. What I find is most interesting here, and let's see if my pen works like it's supposed to, is the two sides are now equivalent. The best and the worst are performing at the same level. At the same time, as AI does really cool stuff, AI can do some bad stuff. When AI gives you an answer, it's really good at convincing you that it's the right answer, even when it's the wrong answer. What I'd like to focus on in this chart is they gave the consultants a task which was beyond the skill set of AI, and they asked the consultants to work on it. And we're going to look at two groups. There was, first of all, the controlled group, which didn't have access to AI. They got it right 85% of the time, meaning wrong 15%. They had a group that they trained on the use of AI, gave them specific advice on how to use AI, convinced them it was a fantastic tool. They got the task right 60% of the time, i.e. wrong 40%. 3 times more errors because AI can convince you something wrong is right. There's three big myths around the use of AI. One is AI is great for content. The reality is it's probably not. It's really great for rewriting. Second myth is AI generates great content on its own. No, actually, AI needs guidance. It needs constraints and needs domain expertise. AI is faster. The truth is it's only faster if it's done right. You also need to trick AI to get it to work right. A sideline, which I just learned today is no longer true, is ask ChatGPT to give you a random number between 0 and 100. It used to be 15% of the time it would give you the answer 42. It's not because it didn't know the answer, but because 42 was an answer that people liked. Generative AI works on pleasing people, giving you the best, most logical thing next in the series, not necessarily the right answer. By the way, if you want to put in the chat why it's the number 42, I'll see if any of you get it right. The challenge in using AI to trick AI is to go one step further. If you ask AI to give you ideas, it will give you weak ideas. What you need to do is you need to break the pattern of where you're asking the questions. The patterns are broken most effectively using something called CAR, context, action, result. I want you to think like this. I want you to do this, and I want your result to look like this. It forces AI into a box and forces it to think differently. The second thing you can do is use something called few shot, which in fact, you're giving an example of what you want as a result, and chain of thought, which is AI improving its results step by step. In terms of effectiveness, you'll have give me 10 ideas. Yeah, not very exciting. Give me 10 ideas, and I have these detailed objectives. I want you to think like this, and I want you to do it this way, and I want you to deliver the results in this format. Pretty good. And analyze the best. Lastly, analyze the best ideas we did in step 2 and improve on each one step by step. Jason, you got it. Yes. Oh, Jackie Robinson. I've never heard that one, but he was number 42. Fantastic. One of the things prompted by this is looking at ways that you can test this in practice. There was a study that was done by a few people at Cornell and Wharton, which was looking at the value of AI to create ideas. What they did is they compared students with AI working on a specific challenge. What I felt they didn't do is do a good enough job defining the objective of what they wanted to do, and didn't do a good enough job using AI in a smart way. So we reran the test. So basically the question is, we'd like you to develop an idea for a product for college students that costs less than $50. We had 260 business school students submitting this as part of a job application. And our test was effectively the following. We had students working by themselves. We had students which we gave them AI, access to ChatGPT. We had students where we told them how to formulate the challenge effectively. And we had a group that were given help formulating the challenge effectively and using smart AI tools. Smart AI doesn't need to be that complicated. Here's an example of the winning prompt in the testing that we ran. So we said, please generate 80 ideas based on the TRIZ inventive principles for our challenge. For each of the 40 TRIZ inventive principles, propose 2 ideas. That's not very complex. But what you need to know is you need to know what TRIZ is, and you would need to know how to define your objective in a way that the AI understands it. So what we did is we ran this automatically. We have a toolkit which is up online, which you'll get a link to. Basically, you select a method, you fill in some data about the target, you click a button, and what pops out on the other side is lots and lots and lots and lots of ideas. Now, what we have here is a total of 5,402 ideas that were generated. 280 that came from humans, 460 that came from humans working with ChatGPT, and 4,662 that came with humans, ChatGPT, and some smart prompts. Because of time, I'm not going to go through this in detail. What you need to know first, average results, really no different. So if you look at human beings by themselves, and you look at the averages here, It gets better when you're using AI, but not a lot better. The second level is we're going to look at the diversity or the novelty of those ideas. And here we have a measure of how different the ideas are from one another called cosine similarity. And what you'll find is human beings develop much more novel and diverse ideas than AI. Why? AI is a people pleaser. So at this point in time, we say, maybe I ran a test that's not going to show any results. But we went one step further and we said, look, who wants 5,000 ideas? And actually what we did was we set up a process to analyze the top ideas, the top 5%. And here's where the kicker are. And if you want to make a screenshot of this page, this is a fantastic result. So what we see here, human beings hit one top idea per 100. Human beings using ChatGPT hit 1.5. They get 44% better, just like that Harvard Business School study. If we help them structure their problem, they get better still. So this is our second leg. But if we give them some smart prompts, they get a lot better. Now, what we're looking at here is not the number of ideas generated, but it's the on-base percentage. It's the percentage of good winning ideas. It is not, it's a lot easier to make lots more ideas with AI. It's more important to know that you're hitting the right numbers. Now, what we've done is we put this into a process, which we're going to show you on a dry run. Tell me what we talked about here, Oliver.
Yeah, so Bryan, as you mentioned, has been working at IBA as a marketing director, myself at Alecta. So we both have been in the radiotherapy market. And I was really challenging him, saying, can you think about a time when this kind of process elevated by AI would really be helped you and being helpful? So let's really see where the rubber meets the road here.
Okay, so we're doing a retrospective sprint. This sprint lasted approximately 25 minutes, and you're going to see the results of that sprint. Now, it's not a 2.5-day sprint. I imagine if we did over 2.5 days, we could have done a lot better. So the context for me is I was working with IBA. We had an event coming up in Prague in a few days. Actually, it was 4 weeks. And we were talking about childcare for cancer. Proton therapy machines are really big. They're really scary. When people move during the process, there are issues in terms of the treatment. When they're scared, the treatment goes less well. And everything focuses and things don't go as well as it should. So what I want to do is look at how we might have done this retrospectively and being careful of time. I'm going to see if I can make it through. So this is our whole sprint. Prep, align, build, so on and so forth. At the preparation stage, this is the most important part of the sprint. What we do is we spend some time, we have some tools available where we can do a detailed market assessment and we can upload these things to a GPT. The idea here is to take the things that we have available that we know about the market, so market data, market assessment data, all put in a place where it's a central resource for a team. The other thing we do is we do some work on trying to define an innovation challenge. One of the things here we did, Oliver and I, is look, let's define what this challenge would look like in a way that AI is going to understand it. We use something called True North. There's a tool, you can get access to it. You fill in the blanks, you get yellow feedback on the other side. Imagine we were doing this day one. We have 2 parts of day one, which is agreeing the targets and building ideas. The morning we start in a sprint, we talk about deep thinking to make sure we're focused on the right problem. We look at the true north, which we'll come to just a bit, and we do the stuff in terms of mechanical creativity. All right, so what is mechanical creativity? And we're going to have a chance for you to show your brilliance. I'm going to still do this example because I think it shows something important about the value of AI. We might go 5 minutes over, so if you have to leave exactly at 5 o'clock, okay, but I think it's good enough to do it. So what we start is an innovation project. We start with something called a true north. A true north is a description of an innovation challenge. It has the context, it has a story, it has the objectives, has constraints, and has guidance. What I'm going to do is give you the true north we came up with, and I'm going to ask you to take that idea, take that objective, and try to develop one idea that we could use to reduce fear for children going in the cancer treatment process. So I'm going to put a timer on. So it'll take you about a minute to read this, and it'll take you hopefully a minute or less to come up with an idea. We start now. This is your chance to beat AI and show human beings are more creative. Brandon, you're the first one in. Yes. Don't be shy, Harvey. You have to put your idea there. John, you can't search on the internet and say, that's my idea. No, that doesn't work. You're going to patent it. Okay, what I want you to do is think about how typically a brainstorming is run in a company. We all get together. We say, this is the moment we're going to be creative. Oh, we're going to go. Who's got their Post-its ready? And coming up with the first Post-its is really, really hard. What you can do to get past the first Post-it issue is actually use AI within the process. It's a two-step prompt. The first thing you need to do is you tell the AI about your challenge. So what we've got is that description that we had before, which was the true north. And it says all the prompts in our session refer to our true north described below in the following true north thing. And we asked it to identify, first of all, come back and explain, do you understand it? And what seems to be the contradictions that need to be solved in terms of creativity? I just see I didn't put the whole prompt in here, but this is good enough. It'll get you. So what we do, which I like about Triz, is it identifies where is the creative tension. So for example, from children, what do they need to do? From the healthcare providers, what do you need to do? The next step, coming back to the fact that I like Triz, I'm going to just use one example and say, please generate 80 ideas based on Triz for our challenge. I'll, for each of the 40 Triz invent principles, propose 2 ideas. And what you'll see is it starts popping these out. Boom, but boom, but boom, but boom, but boom, but boom, but boom, but. Okay, what did the AI do? We gave it 2 prompts. When we use our toolkit, we have a total of 83 prompts. So if you can imagine 83 times 80, you end up with quite a number of ideas. The first one was Triz. Triz gave back 40 ideas, step by step. And my screen just got big. Hold on, I don't know why they got, hold on. I don't know why it's doing this. Hold on. All right, so let's see what happens if I go forward. Sorry about this. All right, so I go forward. We have 40 ideas. We actually did a second prompt, which is focused on related stimuli. Related stimuli usually gets you closer to an idea. We ended up with different stimuli, for example, natural elements, virtual reality. For each of these, it combined, made a new idea. And what we had in this case is we ended up with a prompt saying, look, we just got all these ideas. Please review these ideas and look at them in terms of quality and pick out from all those ideas that 1,000 ideas. And this becomes the start of a discussion. There's no more blank Post-its, but you have Post-its up on the wall. Now, we over-optimized our time. So I was going to ask you to pick the 3 winners. That's not going to work. So what we ended up with is you could have your ideas in the chat. You can have the ideas there. You can bring it all together. So I've got 4 minutes left to do this. So what am I going to do? I'm going to tell you about something really cool. So on the second day, you want to test some ideas. One of the things you can do is say, look, we developed an idea, the idea that we generated before. And what I'd like to do is have you generate a series of personas to evaluate those ideas and provide feedback on the idea, and then summarize key comments and things like that. So what we have, it creates the personas, it evaluates the ideas. As usual, the CFO doesn't like it. No big surprise. And it's too expensive. And it summarizes key feedback. Now, based on this key feedback, you can do one step further and say, look, you know what? We like this idea. This is the feedback we got. What we'd like you to do is improve it and try to write it up as a concept. We are now 17 minutes into our mini sprint, and we came up with the following idea. It was sensory harmony, transforming pediatric cancer care with a touch of wonder. It talks about the fear that patients face. It talks about the promise of being able to change that fear and putting them in a calm environment. We're going to use known technologies to put together a dynamic environmental control, sensory engagement proven to enhance comfort and mood in different settings. It'll transform the daunting experience of cancer treatment to a calm, engaging journey for children to cope better. This has been done 18 minutes since we started. We talk to humans, we get it up. The last part of AI, which we're going to cover, is we're going to say, look, we've got this idea. Tell me, what would you do with it? And one of the things that you want people to do on the second day is to look at the system, look for risks. And what we can do is say, look, identify the risks associated with this project. Pick 3 that we might make progress on in a 2-hour workshop. We tell the people that are sitting in the room, and we say, look, would you take those people which are sitting in the room, 4 technical experts, 4 hospital executives, 2 from regulatory affairs, 4 doctors, and 5 people from our product team. Would you put them into groups, suggest a challenge that they work on, and give them a place to get started working? The end of this, and I'm not going to cover this, is about the time that you spend together after the sprint to make ideas real. You have to connect the dots, you have to put together ideas, and you have to figure out a way to make those things work effectively. Basically, you need time for ideas to germinate. There's lots of tools there. You can come back to the presentation. At the end, what we have is we have 20 minutes later, we have a visualization of what we would like to propose. The visualization wasn't easy, but it is something that comes together. The last day, the make it real day, so we take those ideas, we present them. Management isn't there yet. You get feedback. You give people an hour to update it. You bring the management team in, you pitch it, and you move forward. At the end, they make a few decisions. We use the AI to plan for progress. The end result, 2 to 3 times more results, half the time. The reason for it, more time for strategic thinking, more time for testing, more time for ideas. So more ideas in the process, everything works better. This was a 20-minute pitch, present sprint. If we do it over 2.5 days with human intervention, everything works better. You can get the whole chat with all the things we did here. And now I'm off to Oliver. And we almost made it in time.
Well, the question is, can you do it yourself? And I would say, of course you can, but it's really hard. Okay. I mean, as I said, I've been 25 years in healthcare, working for a variety of different bigger companies, Siemens, Philips, Toshiba, Canon, and the likes. And every time we were driving innovation, if I would have had this at my hands, I mean, I'm just amazed, honestly. It would just have made my life so much easier to really bring people together, to have a basis for discussion also. Very often is a kind of the contradictory and bringing people to the table, aligning on something. And it's not that this needs to be the ground truth at the end, but it helps to invigorate your thinking, to bring it forward, to become more innovative, to bring in different perspectives also very often. So I think it's really amazing. And I really would like to work with you together in order to make it happen forever where you are. So what we can offer you here is kind of that you learn to do more in 2.5 days, that you have whatever you thought is really possible, that are for you, not for us. We need to invest, of course, a little bit more there. So we would discuss kind of what are your key strategic issues, how can we get aligned, how you can get aligned your teams there, build ideas, evaluate solutions, show you how to use the tools there, and then come to make real decisions, real actionable decisions that you also can follow up. So we have something like a budget now for 20-50K that something like this would cost, and that depends on if it's remote, in person, and amount of experts that we would be participating with.
There's a great deal for people that stay to the last page. 2 more slides.
2 more slides. So I think the challenges that we're facing are real, the healthcare challenges there. Innovation sprints that are a proven method. It's been in use since several years now in a variety of different settings. Why not for healthcare? AI is really a powerful partner. Plus these tools, it really kind of peps it up, brings it forward, invigorates this whole process there. And we definitely would like to help you.
Okay, so we covered a lot of ground here. We would love your feedback on this. If you could take a picture of this QR code or follow the link and fill out the form on the other end, we will add Bryan's book, a copy of Bryan's book, Cycles, to all the materials that we will share with you. We will also include the slides from this presentation, the video, 12 books, 70 articles, a lot of material that you can use to run your own innovation sprint. One thing that I would like to mention really quickly, you may be asking, have we done this specific model in healthcare? And the answer to that is no, not yet. We have done regular sprints in healthcare. We would love for you to be the first client for us to apply AI to this process. And to incentivize you, we will offer a 25% discount for the first client who works with us using these AI tools with healthcare. With this, please reach out to us, connect with us on LinkedIn. Reach out if you want to talk. Thank you very much for being here. It's been a pleasure. It's been an honor. And we're excited about what you can do with all these amazing tools and methodologies. Thank you.
So what I'd like to propose is for all of you that have a meeting and we're worried about leaving, leave to your meeting, go, don't feel bad. We're out of here, no problems. For anybody who would like to ask tough questions, Oliver and Andrew are here to answer those questions. For anyone who'd like to ask easy questions, I'm here to answer those questions.
Thank you, Bryan.
Why don't we do this? If you have to go, take off. But what I'd like to do is open up the floor and say, look, if you have a question, if you believe this can work, but really, go fill in the feedback. We'll send you links to everything which is here. And I think you might be amazed at what it can do. All right. Does anybody have a question? It must be really good.
Tough question.
Do you believe it? Okay, Anthony, tough question. No.
Should I speak or?
Yeah, go ahead. Ask your tough question. Go ahead, my friend.
Oh, all right. So just a thought. Thank you for the amazing presentation. Because you mentioned a North Star, some kind of objective. And I would say in healthcare is particularly tricky because if we are really honest to ourselves, the North Stars are really boring. They have to do with prevention and awareness, and they don't give us the opportunity to nerd out and make beautiful hardware and software and stuff like that. And so it's kind of an identity question. Like, are we trying to make the best healthcare? And if that's the case, like the bottleneck, I guess it's accessibility and all those boring awareness things, versus trying to make nice hardware because or tools like you make, they're wonderful and they're still useful, but they're not the optimal, resource destination, probably, if my assumption is correct. That's my question.
So I think within your question, I think there's a challenge within healthcare. Sometimes the better your job, the less money you make, which is a problem. And sometimes you can be very, very focused on the value and true North Star doing something fantastic that might not be available to you. Your job is to bring the two together. It's to show in the world of abundance, you can do the right thing and make more money. And by the way, that's an innovation challenge in itself.
Mm-hmm.
How is prevention is always making less money, no?
Maybe it makes more money. So
No.
maybe people are willing to pay not to be sick. I've been doing work with a company in proteomics, which is doing protein screening for early analysis of cancer. So the idea being is you look at your proteins and screen to see if you have cancer coming. And they're looking very wealthy clients willing to pay $20,000 a year to do an annual screening to see if they have cancer coming in the early stages. Actually, they're making more money off of this than treating the cancer. Because not everybody gets cancer, of course. So there can be money in prevention, Anthony.
That's early diagnosis. I mean, like just walking and losing weight. But you're right, like the early adopters are paying for the technology to develop and then become more accessible. And
yeah,
but these are two like this is a happy coincidence, I would say. And again, I absolutely love this, and I find much more interesting than doing social campaigns and stuff like that. I'm just putting it on the table.
Yeah, I think it's good.
So you're absolutely right that within the confines of the school of thought that we're all used to, you're right. Making money off prevention is hard. But I read somewhere, and I don't quote me on this. I don't remember where that was, but supposedly in ancient China, you paid your doctor while you were healthy, and then they would treat you for free. So and then the job of the doctor was to keep you healthy, right? So AI and these tools and these innovation approaches can help us ask the question, what else is possible, and help us start finding the answers to that question. So I would not see it as a constraint. I would see that as a framing for the question. And then, as Bryan said, it is an innovation challenge in and of itself.
So a typical innovation challenge is an objective with a constraint. I want to drive a car. I want a car that drives faster and is safer. I want my wife to be happier and I spend less money on her. Things that don't work together. For example, here you want to make more money and focus on prevention. That is a contradiction. That is an innovation challenge.
Yep.
Cool. So we've got the things here. What will happen is if you, we'll send you off the link for the feedback. We should have put that up in the chat. We didn't do it. I hope it worked for you. And I would like to thank all of you for being here. A big hats off to the people who asked the difficult questions, the people who participated in the chat. And thank you very much.
Thank you.
Thank you. It's been a pleasure being with all of you. Thank you so much for participating.
Cheers.
Thank you.